Hey guys, welcome back to our new video, and today we're going to discuss about the rheumatoid arthritis. Yesterday we discussed about the carpal tunnel syndrome, but I think it was quite good, but the voice there was a little bit slow. I checked after that, and I hope today it's clear and everything is gonna fine. So you can let's start our discussions with rheumatoid arthritis. See, when we code it rheumatoid arthritis, the first question should come in our mind, which is the most common connective tissue disorder. The most common connective tissue disorder, that is what rheumatoid arthritis. So the rheumatoid arthritis, remember, that is what we have, that is connective tissue disorder. The rheumatoid arthritis is what, that is our connective tissue disorders. So always remember that it affect the synovial joint. It affect the synovial joint. So in the synovial joint, we will having the synovial fluids. We will having the synovial fluids. So when the synovial joints will be affected, the synovial fluids will be affected. So because there will be the, we will see in the synovial fluids that will be the lost, and due to which there will be the narrowing of the, the narrowing of the joints will be seen in case of rheumatoid arthritis. Along with that, we have that like in the two stages, we have the early stages as well as we have the late stages. In early stages, what will be there, we will see the narrowing of the joints. In early stages, what we will see, we see there is a narrowing of the joints, but in the later stages we see the deformities. So always remember, in the early stages we see there is a narrowing of the joints, but in the later stages we see the deformities. What type of deformities we see? We will study everything like botanist deformity, swan neck deformity, mallet's fingers, everything we will discuss. Along with that, we will discuss the images as well. Rheumatoid arthritis, remember, this is also known as, I'm writing it here, this is also known as sero, this is also known as seropositive arthritis. Oh, what is seropositive? Seropositive, okay. So seropositive, remember that it means that is the RA, rheumatoid factor positives. The osteoarthritis we will talk, and ankylosing spondylitis we will talk, that is rheumatoid factor negative. But in case of the rheumatoid arthritis, they are the seropositive arthritis, means we have the rheumatoid factors, these are the rheumatoid factors positive, these are the rheumatoid factors positive. So rheumatoid arthritis, remember, these are the seropositive arthritis, and in this condition we have the rheumatoid factors will be the positive. Now what will be the next question should be there. See, in rheumatoid arthritis, if there is arthritis, so what comes in our mind means something, we have the joint inflammation is there. So which is the most common joint involved in the rheumatoid arthritis? The most common joint involved in rheumatoid arthritis, so that is what, that is, yes, you all are correct, that is metacarpophalangeal joint, that is metacarpophalangeal joints. And other than that, we can have the PIP as well. So what is the PIP? That is the proximal interphalangeal joint. I hope you all are clear about the proximal and distal. See, this is my proximal and this is my distal. So this is the proximal joint and this is what we have, the distal joint. The proximal interphalangeal joint, distal interphalangeal joints. So which one will be spared, will be not affected? So the DIP will be spared, that will not affected. So DIP will be spared and that will not affected. So remember these things, the most common joint involved in the rheumatoid arthritis, that is metacarpophalangeal joint and proximal interphalangeal joint. Which one will be the spared? That is DIP will be spared, that will not affected. So let's talk about the deformities, because these are the important points you need to remember. So remember guys, these are the deformities. So remember always the deformities we talking, these are like swan neck deformity. Okay, before that let me write it, let me write first Botanius deformities. Let me write, because B comes first, that's why. So remember the Botanius deformity, the Botanius deformity. So in the Botanius deformity, remember, we will having the flexion at PIP. We will having the flexion at PIP, and there will be the extension at DIP. There is a flexion at PIP and extension at DIP. I hope this is clear. Okay, the next one we have, that is swan neck deformity. That is what we have, the swan neck deformity. So what will occur in the swan neck? So remember guys, so there will be the hyper extension of the PIP, hyper extension of PIP, the hyper extension of the PIP, and there will be the flexion of the DIP. See, remember the botanist deformity, and opposite of that is the swan neck deformity. And why there is a flexion at PIP? Due to which there will be the some extensions, or if there is a hyper extension at the PIP, at DIP there will be the flexion. So opposite will be there in the PIP and DIP. So remember the botanist deformity, the flexion at PIP and extension at DIP. The opposite of that will be the swan neck deformity. Other things we will see in this condition, that is the mallet's finger. Which one? Mallet finger. So remember this one as well. This one is known as the mallet finger. So mallet finger also you need to remember. The mallet finger, remember mallet finger. Also remember, that is not so important, but you can remember it like that. If we have ulnar deviations, if we have the ulnar deviations or ulnar drift is there, if ulnar deviation or ulnar drift will be there, in that condition there will be the zigzag deformity we will see. Which deformity? Zigzag deformity. Okay, so remember these things, all the deformity that are super important: botanist deformity, swan neck deformity, mallet finger, ulnar drift, that is zigzag deformity. All these deformities you need to remember. I hope you will able to. Now let's see the images. See, we are seeing that there is a swan neck deformity. We seeing that there is a hyper extension. This is the PIP joint and this is the DIP joints. See, there is a hyper extension at the PIP and there is a flexion at the DIP. This is again the same, the images of the patient, that is hyper extension at PIP and flexion at the DIP. In botanist deformity, what is there? There will be the extension at there is a flexion at PIP. Sorry, that is flexion at PIP, and in the DIP we will see that there is a extension at DIP. There is a extension at DIP. So remember, this is what botanist deformity, and we have the swan neck deformity. These are the two deformity that are super important. Other than that, you can remember that there is a mallet finger we will able to see, and along with that we can see that there is a zigzag deformity. And also remember, we have the rheumatoid factors. These are the rheumatoid factors positive. These are the rheumatoid factor positive. That's why we called it seropositive arthritis. I hope this is clear till now, and everything is perfect. So I hope this is clear, and if you like this video, please consider the subscribe button and press the bell icons to get the more updates, and other next topics will be our osteoarthritis. So see you in the next video. Bye bye. Hare Krishna.